Good evening, everyone, and we welcome you here to the Annenberg Center at Eisenhower Health here in Rancho Mirage on a very beautiful summer day, almost summer, even though it's May, and it was lovely out today. And my name is Bill Stark. I'm the president of the Mended Hearts of Coachella Valley, and we want to welcome you all here and the folks that are on Zoom. We started Zoom a little bit earlier because we have some logistic issues going on tonight with all kinds of meetings here in this building. So we're all you should be able to hear on Zoom. And what the plan is we're going to have our two speakers tonight, which is an unusual thing. They are both heart patients, and they are going to talk to you about women and men and all those kind of things, how really interesting it's going to be. So we've kind of deviated from the normal doctor thing or a nurse that we might have. So this is a more special program, actually, because we're talking to the people that have gone through something for sure. And we've had Carolyn Warner here and Liz Young here. And so we're so proud that you guys are doing this because I know it was going to be very educational. They've suffered from misdiagnosis. They've had, they're going to talk a little bit about how different women are than men. And us men already know that anyway. So, but one was born with heart issues, and then they've had a litany of things throughout their time and in their journey here in this heart stuff. So, and I want to also say that both of them have been kind of personal advisors to myself and my wife, particularly we've had common things happen to us. Our daughter, when she was 42 years old, had double bypass. I talked to Carolyn every day when she was in that hospital. And it was very, very helpful, I'll tell you what. So relative to question and answers, they're going to do their presentations and talk, and we'll have question and answers at the end. They'll come up on Zoom as well. So we have a roving mic, or a mic that will go around and get your questions so that the people on Zoom can hear, okay? Is there a Zoom address? Is it on the flyer? It wasn't on there? Let me see. If you got a newsletter, or somebody give us a newsletter, it might be in there. Oh, yeah. Right. If anybody's missing, that's good. Look at the calendar for tonight, and then it'll take you right to that and should be able to register and get that. That's great. So without further ado, I'd like to introduce my friends, Carolyn Warner and Liz Young.
Thank you. As Bill said, my name is Carolyn Warner, and this is Liz Young, and we're going to share with you some very important information tonight. It's nice to see all my friends out there. I'm sure I've shared this story with all of you before, but we're going to learn a lot tonight because it's really shocking how different men are from women when it comes to heart disease. But first, to get started, why are we meeting about women and heart disease in May? We think of February as the Go Red for Women month and Women's Heart Health Month, that sort of thing. Well, actually, today, this whole month of May is Women's Health Awareness Month. So we fit right in. And it's also Stroke Awareness Month. And so again, when I was being given information at the Mayo Clinic, a lot of people referred to having a stroke as having a brain attack, just like having a heart attack. Actually, it's still a part of the whole cardiovascular system, and they are connected. And as we well know, right, Liz, AFib can trigger stroke. So this is Stroke Month, so that's important, and we'll mention that too. And finally, Mental Health Month, believe it or not. This is Mental Health Month, and lots of heart issues and events are triggered by stress and depression. So we sort of covered all the bases this month, Bill. What do you think about that? And just as a little side note, May 8th, today is my father's birthday, or would have been. He would have been 105, but he did die of a heart attack at 44. So my history actually starts with genetics. And tonight, what Liz and I are going to do is share with you our little personal stories. And then we're going to also share with you risk factors, and I will share with you atypical symptoms that women present themselves with when having heart issues. We're going to cover the whole cardiovascular disease with women, and mine is coronary artery disease. Liz is more the electrical problems. So we feel like we're going to cover all the bases, which is going to be absolutely phenomenal in only 1 hour. We're going to try and leave 10 minutes for question and answers. There is so much to talk about. And before we get started, just as any other speaker has done, Liz and I have to present our disclaimers. So Liz, were you paid to do this program tonight?
I am not paid, but I did get a voucher from the hospital for volunteering for the cafeteria.
And it's gone from $4 up to $8. So that is a big deal. Liz and I are both actually accredited volunteers at the hospital, and we are also certified to be Mended Hearts visitors at the hospital. But she's pretty active with the regular visiting program too, so that's really wonderful. So moving right along here, after the next disclaimer we really probably should do is, just as we do when we're out visiting, we make it very clear with our patients and family members that we are non-medical people. Heaven forbid we should say something that a doctor would tell us was not correct. We see our medical issues from a whole different angle than the doctor. Sometimes we feel like we're doctors. As a matter of fact, a year after my open heart surgery and lung surgery and everything else that went along with it, my husband had a big celebration of my life, which was lovely and a nice surprise. And my thoracic cardiac surgeon was there and his wife. And he presented me with my doctorate degree. So his name is Michael Wood. And Dr. Wood, he's incredible. And I think he's doing heart transplants now in Virginia. But anyway, he gave me this certificate of a doctorate degree in cardiovascular disease presented to me, Carolyn Warner, in recognition of her personal, in-depth educational experiences from the School of Hard Knocks. Well, a lot of these things that Liz and I will be sharing with you tonight, we know you personally out here in the audience. And those of you on Zoom, we probably know you too. And we've had an opportunity through our Mended Hearts meetings to share a lot of our experiences. So, but we're just so happy to be here tonight to cover this. Before we actually get started, there's one more thing I want to mention. On the table are some handouts. There were more in the mail. This was sort of last minute. And when I receive them, I will be sure and bring them to our Mended Hearts meeting so you can get them. Normally, I would be handing out a gift bag from Women Heart, which is the National Coalition for Women with Heart Disease. And it's an organization that provides support and education and advocacy. Actually, I've represented them in Washington, D.C., contacting our senators and our Congress representatives. In fact, one time I went there to represent a bill we were trying to get passed. Now, I don't think there's any hope for that sort of thing, but it was really interesting to be able to have that opportunity. So when I get these, I will pass them along to you. But in the meantime, I'm a hoarder and I have stockpiled many things. And even in my move, I was able to save them. And on the table, you will find want to open that up, Liz? You went through that with me. The first, right. Well, first of all, this bookmark you should keep with you as a reminder of what symptoms of heart disease are, because they are different. And I will be covering that in detail as we begin our program, but it's nice to have it in print. And then on the back side, it talks about what you need to do if you think you're having a heart attack as a woman. And we'll cover that more in detail too. So the bookmark, and then, lucky you, I've been around so long. I remember when the Red Dress program was presented by the National Institute of Health. They developed the program and they presented it to Laura Bush when she was living in the White House. And she introduced the program, the Go Red for Women program. And of course, down the road, others picked it up, like the American Heart Association. And we have some of those pins too. But the really beautiful ones with the gold heart are from the National Institute of Health. And I just hope they're going to be in business for a while, because they are certainly an asset to women and heart disease and everybody. Now, some of these pins actually do say Boston Scientific too, because they are our #1 supporter of women with heart disease. Also, I love these little hearts. And these did come from, I believe, Boston Scientific. And on the heart pin, there are 2 gold lines. And it's just to represent the disparity between men and women when it comes to treating heart disease. But it also represents the disparity between women of different cultures, colors, financial backgrounds. I mean, there's a lot of disparity within the women that have heart disease. And we have to think of all of those things as we care for others. So I love that disparity pin. And what else do we have here? Oh, well, on the front side of this handout, it says, I have heart disease, now what? And it guides you through what something you can be doing living with heart disease as a woman. And then on the back, it said, now I'm ready for action. So just some information. And there's some little wristbands if you're interested in that too. And finally, Liz, you want to talk about this? I love this. We use these in our as handouts with our visiting program.
Fill these out, put them in your wallet. It's got your name, your address, what your illnesses are, your doctor's phone numbers, any prescriptions or anything that you're taking. Keep it in your wallet. And somebody said this to me, a friend of mine, about a month ago, because I'm getting ready for some cruises that I'm going on with my friend. And he's like, does your friend have all your information? And I'm like, well, I don't know. She knows I have heart problems, and so it was suggested, if you're doing traveling other than your partner or your spouse, fill these out and give it to the person you're traveling with and have them do the same for you, so that you've got their information and you've got theirs in case you can't give your information. I know a lot of people put it on your phones, but what if your phone is locked or you don't have your phone with you? At least the person that you're with is going to have your medical information. Just a
Thank you. Thank you, Liz. And this particular form, of course, it has your name and it has who to contact and also other information like your doctor's phone number and that sort of thing. And on the back side is a list of medications. And once this is all filled out, just fold it, and it's the size of a credit card. And it slips into your wallet with your other credit cards and your driver's license. And actually, to be honest with you, it came from the American Heart Association. And the first responders know to look there. They also know to look on your refrigerator. Mine's not updated yet, but this is what I have on my refrigerator. And it's the same sort of information, especially if you live alone or, oops, you need to have this handy for the first responders to find. You don't want it stuck in a drawer somewhere or in your wallet or in your purse. So they know to go to the refrigerator first. They know to go to your bedroom door also. So if you don't want to hang it on your refrigerator, or you have one of those refrigerators that the magnet doesn't stick on, be sure and have it near your bedroom door. What this is going to do is speed up any treatment that is necessary for you in a timely manner. And speaking of that, Liz and I were talking before, and then we're going to get started, Liz. But we were talking about the first responders. And years ago, when we were having the Go Red for Women luncheon, for the American Heart Association, they were pretty strict about funding being kept with them so that they could disperse it in the big pot across the whole United States. Well, needless to say, when you live in the Coachella Valley, you want to donate and keep it in the Coachella Valley. That's pretty much what people feel here. And so Alita Bennett, who actually was the director of volunteers here for a short time, she was the chairperson that year. And she said, but we have to have money stay in the desert. So she approached the hospitals and she found out where the need was. And so then we had a side, we passed the fireman's boot around and we collected money on the side, and they allowed us to do that. And what the hospitals really needed was they had a home base for their STEMI system, but they did not have the contacts to the first responders, CAL FIRE in their truck and that sort of thing, and the ambulances. So they wanted to have that connection, and it was going to cost about $60,000 to $70,000, and that would have been for Desert Regional as well as Eisenhower. And once we found out what they needed, then we had a purpose, and so we passed the boot around at the luncheon. Maybe some of you were there. And believe it or not, we got $15,000 put in the boot. I don't know whether it was the boot, the idea of the program, or those cute firemen. I'm not real sure. But we did donate $15,000. And then, amazing, Mr. Clark, whose wife had died from heart disease, he matched the $15,000. And then, guess what? The Berger Foundation matched the $30,000. So we had our $60,000 that we gave to the hospital. We had our picture taken with the firemen outside the fire station, presenting the money and all that stuff. But anyway, I just think it's important for you to know that you must call 911 if you're having heart issues. Don't think that you can drive yourself, and don't ask somebody else to drive you either. Call 911, have the first responders come out. And now that they have the STEMI system, which they've had for a few years, I'm not sure what STE is, but I do know what MI is. Heart attack. So anyway, then what happens with that is they can feed information about you back to the hospital that they're taking you to. And they not only know all of your medications and your vital signs, they know how they're going to treat that. You can actually start being treated in the transportation part of this. So, and all that information is sent to the resident cardiologist at the emergency room. So it's pretty vital that you call 911 if you think you're having a heart attack. We're going to talk about symptoms, and some of the symptoms for women, although I feel like I'm preaching to the choir, you've all had issues and you kind of know, but sometimes they're so subtle, and we'll be covering that you don't recognize them as heart issues. But trust me, Desert Regional and also Eisenhower are happy to take you in and find out. They will not turn you away. Liz and I both have had experiences where we were patronized, and what's the word, Liz? We were not taken seriously after all. We were women, we were young, we looked like we were in relatively good health, and in fact, I was told many times it's anxiety, it's hormonal. honey. And did you have an argument with your husband this morning? And I said, no, I have coronary artery disease and I know my body, I know my symptoms, I know I'm in deep trouble. Please help me. And to have to beg for help, this was years ago. It's so much better here, but in other parts of the country, it's not. So that's something we're going to talk about a little bit too. Okay, guess what, Liz? Now we're going to share just a bit of our history. We'll put our lives out there in perspective, and all of you have interesting stories to tell. But we're going to share with you in about 10 minutes a little bit of Liz's and a little bit of mine. Again, thank you for coming, and now Liz is going to talk.
Hello. Is that working? Hello? Okay. I'll do a little bit of reading. Can you hear it? Can you hear me now? Okay. Hi, my name is Liz, and I'd like to start out by bragging that I've probably had heart issues no longer than anybody in this room. I was born in 1959 with congenital heart disease. I had coarctation of the aorta, which is a narrowing of the aorta that comes right after the arch. I had my first open heart surgery in 1964 at the age of 4.5. They had to remove part of my aorta, and then they just sewed the two ends together, patched me up, and that's what they had to do. Everything was good with me, living a normal life for about almost the next 50 years. And then in December of 2012, while at work, I got something in my eye, and I had to go to the urgent care. And I ended up going there 3 or 4 times just for the eye issue. But on my last visit to the urgent care, the doctor comes up to me and she hands me a slip of paper with my blood pressure readings. And she's like, your blood pressure is just way too high. And I'm here. You know, how many people have heard white coat syndrome? I'm like, no, it's just because I'm here. I'm fine. She's like, no, your blood pressure is way too high. The blood pressure is the silent killer. And so told me to go see a cardiologist, and I didn't do it for a few months. I'm almost embarrassed to say, someone that has had heart issues. So it actually took me a few months before I finally went. I didn't have any symptoms. That was the problem. I felt fine. I had no symptoms. And that's the problem with high blood pressure. I would get an occasional headache, but I just figured, that's work. You know, that's normal. So it took me a few months till I started getting more headaches. And then I thought, okay, I think it's time to go see a cardiologist. I did. And then after doing a few tests, I was told, now it's time to go see the cardiothoracic surgeon. I need open heart surgery again. My aorta had re-narrowed. Doesn't happen to everybody, but I'm the lucky one. So in January of 2014, I had a second open heart surgery where they did the same thing. They had to remove part of my aorta, only this time when they did it, they couldn't connect the ends because now they've taken out so much. So I have a Dacron graft that connects the two ends. The second open heart surgery brought on a whole new issues for me. I experienced my first AFib attack the day after my open heart surgery while in the hospital. So I was born with a plumbing problem, and now I have an electrical problem, as the doctors like to say. I spent the next 3.5 years in and out of the ER and special procedures. I had 5 cardioversions and 2 ablations, 1 ablation here and 1 ablation at UCLA. Again, everything was going good until August of 2017, when I was diagnosed with stage 3, grade 3 breast cancer, aggressive breast cancer. Lucky me. By March of 2018, the flutter started up again. They took care of the AFib with the ablations, so I just go into flutter. With my breast cancer, I had to do chemo and radiation. And so by March of 18, I was going back into flutter. The next 4 years, I had 6 more cardioversions and 2 more ablations. Again, one here and one at UCLA. I keep my doctors busy. April of 22, I got my first pacemaker. My doctors decided that I got the micro leadless pacemaker, which is the small little pacemaker that goes inside the heart. And that worked for almost a year. And then in January of 23, I needed to have another cardioversion because I was back in flutter. That happened to be the same month that I was here at a Mended Hearts meeting. And Dr. Logston, who is one of our cardiothoracic surgeons, was the speaker. And he happened to be talking about a procedure that he was now doing here at Eisenhower called the hybrid convergent procedure, which is an ablation on the outside of the heart instead of the inside. They make an incision below your breastbone, they go up underneath your ribs, and they do the outside, which is scarring of the tissue. Normally it's on the inside, and they do that on the outside. I talked to Dr. Logston after the meeting, and I asked him, can you do this for flutter, and other than AFib? And he said yes. I made an appointment with him, and he then had me go see Dr. Sonson, Dr. Feldman, make sure it was okay that I could do this. And Dr. Feldman recommended that before I do this, I get a dual chamber pacemaker. So in March of 23, I got a dual chamber pacemaker. Yes, I have 2 pacemakers. Dr. Feldman said, just think of the other one as a backup. When they do a pacemaker, they also do an ablation. So I had another ablation. My first part of the hybrid procedure was done in August of 23. And then that's followed up. Mine was in October of 23 with an ablation. It's like a 2-part thing. Since October of 23, I have only had 1 cardioversion, which is good for me. So, it's working. The reason I did ablations was because I wanted to get off meds. I don't like taking meds. I didn't want to take meds. So I knew, by doing ablations, I could possibly get off my medication. If you're on meds, you're doing good, stay on them. But I didn't want to be on meds. Today, I take no heart medication. I know. And so far, so good. Thank you.
Oh, thank you so much. Wow, what a story. And she has a sense of humor about it all and a good attitude. She's really one of the most courageous people I know. And incidentally, courage, the word comes from a Latin derivative of curry or something like that, and it means heart. So here's our courageous heart person. Wow. And not only that, but she's busy as a bee. I mean, she volunteers, as we mentioned before, at the hospital. I'm on Facebook with her and I can hardly keep up with her. She's at every big event over at AccuCenter. And she always lets me know when she's going to the show and out to dinner. And oh, she's so much fun. And now I just asked her where her next cruise was, and she describing Iceland and Norway. Oh my goodness. I don't know. She's constantly booking tours, right, Barbara? Barbara, her sister, is here. So if you want an inspiration, just hang around Liz. And she squeezed in being one of our board members. She is our treasurer at Mended Hearts. So thank you very much, Liz. Now, I forgot to tell you the really vital stuff about women and heart disease. Actually, what?
Tell your story.
I will. I know it's my time, but I forgot this part real quick. I just have to say, I have a library of heart books, but I love this one, Women Are Not Small Men. And I said, that's what we should title our presentation. And Bill said, do you think that she has that, anyway, do you think we can copy that? Anyway, no, we can't copy that, but it's the truth because actually, yes, heart disease is the #1 killer of men, but heart disease is the #1 killer of women. And more women die from heart disease than men. So go figure. And actually, that really got started about the 1980s. Prior to that, it was more men than women. But what do you think happened in the 80s? Women went back to work, but they still managed the household and the children and so forth. And as we mentioned before, I'll be covering this, but one of the risk factors is stress and depression. So we suddenly elevated ourselves. And not only that, but we're discovering all sorts of things. For our country, we should be ashamed of the fact that many women die at childbirth. There's eclampsia, there's high blood pressure, it introduces diabetes into the system. So there's really a lot going on there. And plus, we happen to be blessed and and maybe not so blessed by having hormone issues. So we have to sort of balance those with everything that's going on. But about 60 million women have some sort of cardiovascular disease. And about 500,000 will die this year from cardiovascular disease. Some statistics that I recently looked at say more like 420, but any way you look at it, it's more than men. And more women die from heart disease than the next 9 causes combined. And that includes breast cancer, lung cancer, automobile accidents, and anything else you can think of. Just bulk it together, total those numbers, and they still don't reach the number of women that die from heart disease. So why is this? Well, there's a lot of reasons, and there's a lot of hospitals and universities that have put together a lot of research, support systems, educational programs, advocacy programs, because this has to get out. Why is it this way for women? Why are we doing this? And many of these programs have been funded by National Institute of Health, or HHS, and now they're not. So it's really sad because there's some really innovative research being done. I was just reading about the fact that pregnant women develop their own vessels. Obviously, they need extra vessels to carry a child and a baby. And so there was research being done at Yale University, because what if through research we could discover how vessels can grow? Yes, we do have what they call collateral vessels that go over blockages in our arteries. That is true. God's little bypass. Sometimes it saves us until we get help. Sometimes it doesn't. But there's so much research going on. And as I say, it's connected with many hospitals. Are you listening, Dr. Patel? Because we're building a 4-story beautiful heart center, and there should be a small portion of that dedicated to women in heart health. And we should make available screening, for example, educational programs for women, and we'll get to that and the reasons why, because we present ourselves so differently. But even Barbara Streisand, who does not even have heart disease, she was reading an article and she felt that it was so important and vital for women to get more support. So she actually funded the beginning of the program at Cedars-Sinai that they have. When it first started, it was called the Lady Killer, but now it's something like Women and Heart Disease Center or something simple like that. But it is the Lady Killer program. You can even find that on Google. But she started it with Noelle Barry Mertz. And some of you have been around as long as Bill and I have. And Carol, maybe you remember, she was a featured speaker right here at Eisenhower in our large auditorium. And she told the story of the start of that. And I've worked very, very closely with Sharon Hayes. Dr. Hayes, she heads the Women Heart Clinic at the Mayo Clinic. And she's the one who partnered with Women Heart when they first started and organized symposiums, educational leadership programs for women with heart disease. And so anyway, I'm just throwing that out there. Okay, let me get back to business. It's my turn to tell you. Well, as I mentioned before, my father did die at 44 of a heart attack. That was a surprise to everybody. But in 1965, we didn't know much about heart disease or the genetic connection. His father had died at 50 at the breakfast table in front of his 4 children. That was my grandfather. But I didn't realize, as anybody did, that heart disease was a genetic thing in the family. When I was in my early 50s, I was developing shortness of breath and extreme fatigue. And I ended up, I'm going to speed this along because I want to have more information on the important stuff, not me. But anyway, I went to a local community hospital. I had to pull off to the side of the road while I was driving on the freeway to a job I was going to. And I didn't want to die at the Chevron station, so I went right past it to the Shiloh Inn, and I pulled inside, and I went inside and told the receptionist that I was not feeling very well. Could I just sit down? And the next thing I knew, I was on the floor. And so she called the Pomona Fire Department, and they took me to a small community hospital in San Dimas. And they did what they thought they should. There was a cardiologist on duty, as a matter of fact. And after he did all of his testing, he handed me a brochure on anxiety and told me to check with my doctor. Well, that was just the beginning of misdiagnosis all the way along. By the time I went to my primary doctor, he referred me to a cardiologist, and the cardiologist gave me my first heart catheterization or angiogram. I've had 10. Ta-da! Do I hold the record? No, I don't think so. Anyway, I've had 10 in my life now, but that was the first time, and they did find blockage, and they did put they did angioplasty, which is where they take that same catheter that they have released the contrast materials with, and they go back up into the area where the blockage is. They pump from the outside, they push the plaque against the wall, and just hope for the best, hoping it stays there. They retract the balloon, they pull the catheter out, and good luck. Well, none of those worked. I had 5 angioplasties. And then my husband and I were traveling on vacation in Switzerland. We were in Interlaken, a beautiful little town. And we went on a side excursion to the capital, Bern. Thank you. And we were walking the streets, and all of a sudden I got those symptoms again. So I knew I was in trouble. And by the time we got back to the hotel room, we took a train. My head was down on the little table that we sat next to on the train. And then I ended up spending a weekend in the Interlaken hospital, and I was assigned a nurse. Irene. She was so sweet. She was my personal nurse the whole way through this adventure, which I thought was interesting. I had the most beautiful room, and I had an incredible view of the Jungfrau in Switzerland. And my husband's window looked out to the parking lot of the hotel. I had the best view. Anyway, of course, I was on morphine, so I don't know what. But they were just sort of keeping me alive until Monday, till the cardiologist came to check me out, and I didn't pass. So I ended up at the university hospital, and they did the heart catheterization, and they said, we're going to put a stent in. I said, there are no stents in my artery size. And he said, oh, that's your FDA. I actually was a doctor for 10 years in Boston, and they're so slow at approving things. We invented the procedure, and we have stents of all sizes here. So anyway, that was a little fortunate encounter. So that worked out great. And he gave me this little note and said, don't mention to anybody that you've had this procedure done, especially to the pilot of the airplane, because he probably won't want to take you across the Atlantic knowing you'd had this done. But he said, but I do recommend you stay 1 more week in Switzerland. Well, twist my arm. Because as any of you know who have had this procedure where they open up your artery, you suddenly feel fine. You know, it's once the blood platelets can get through, you usually feel pretty good. So anyway, then it goes on. I came home and I had a couple of more stents. So I had 3 stents and 5 angioplasties. And then what really surprised me was I should have known better. My symptoms were usually shortness of breath and extreme fatigue. But this new symptom that I didn't recognize as heart disease was jaw pain. It was so severe and it came on a Friday, so severe that I had a regular dentist appointment on a Monday. So I went ahead and lived on Motrin for the weekend. Went into the dentist on Monday, and it was my regular dentist, and he just did x-rays and a checkup and cleaning. And he said I couldn't see anything, but it could be a hairline fracture. He sent me to the endodontist who had done a root canal in that area. And he said, oh no, my job is perfect. Everything looks fine to me. So I went to my periodontist who I used to alternate with. I really liked him a lot. He said, look, if they pull that tooth out, it won't change the structure of your jaw. And he gave me a referral to an oral surgeon across the street. I literally had the tooth pulled. It was never the tooth. It was heart. It was a heart symptom. And I lived for Tuesday, Wednesday, Thursday. And by Friday morning, I got my symptoms. I couldn't stand up and I was short of breath. So I grabbed my Ziploc bag of medications, not in this town, this was in another town. And I unlocked the front door. And the city that I lived in did not have first responders, it was the fire department. Now they do. But anyway, when the fire chief walked in my door, he said, you seem a little anxious. Did you have an argument with your husband this morning? I said, no, I have coronary artery disease. I know my body and now I know a new symptom and I know I'm in deep trouble. Please help me. Anyway, so that worked out fine. I got to the hospital. Um, I didn't pass any of the tests. I failed the stress and everything. Anyway, they had to put a balloon around my heart. Now they use an impeller to keep it functioning, to keep blood flowing through your body. But for 24 hours. And then Saturday night, they did surgery, open heart surgery. It was a blockage of my main and the 2 descendings, a 3-way bypass. So I didn't wake up until about Monday, but then I heard all about it. And I said, I told the nurses in ICU, beautiful music you were playing. I really enjoyed it. And they said, oh, no, we're not allowed to have music in here. I don't know where I was. But anyway, all is fine. That's over with. And 2 weeks later, I'd been in for my 3rd tap into the lungs from the back. I don't know if you've had that, but I couldn't breathe. I was suffocating as I was recovering. And then I had my same thoracic cardiac surgeon do lung surgery on this side and reach in and pulled out 2 blood clots. We're not wearing bikinis this summer, are we? Anyway, that's pretty much my story. I really feel great. I haven't had an incident since, but I have a wonderful cardiologist, and he makes referrals for me for my regular checkups and testing and all of that sort of thing. Now I'm going to hand the microphone, or actually Liz has her own. We're going to cover the important details. Now that you know all of our stories, Liz is going to talk about risk factors for women with heart disease.
No. Hello. Okay. Women face a higher risk of heart disease due to the combination of anatomical, physiological, and lifestyle factors, as well as a unique health challenge associated with pregnancy and menopause. Heart disease is the #1 cause of death in women. The reason is that there is often a delay in diagnosing coronary artery disease because of the symptoms are different in women than in men. Some of the risk factors: age, just being a woman, Smoking. Smoking is a greater risk factor for women than it is for men who smoke. Alcohol, physical inactivity, unhealthy diet, pregnancy complications, obesity. Obesity is a major risk factor for heart disease in women, particularly in relation to high blood pressure and gestational diabetes. Breast cancer treatment. Treatments for breast cancer, such as radiation and chemo, can damage the heart and increases your risk of heart disease. Diabetes. Women with diabetes are more likely to develop heart disease than men with diabetes. High blood pressure. High blood pressure or hypertension is a major risk factor in heart disease and stroke, the silent killer, because there's usually no symptoms. High cholesterol. High levels of LDL cholesterol increase the risk of cardiovascular disease. Make sure when you're having your normal blood work with your doctor that they include a lipid panel. Make sure you know your LDL, your bad cholesterol. Menopause. A decline in estrogen after menopause can increase the risk of heart disease. Oral contraceptives. Women who use combined oral contraceptives are a greater risk of heart attack and blood clots, particularly over the age of 40. I think that's everybody in here. And if you smoke. Family history. If one of your immediate family members, such as a parent or a sibling, has a heart attack or stroke or was diagnosed with heart disease before the age of 60, this may indicate a family history and premature heart disease and makes your chances of developing heart disease a greater risk. Stress and depression is strongly linked to increase in heart disease in women. Stress can trigger a release of a hormone like cortisol, which has been linked to the increase of heart disease. Depression and anxiety can lead to lifestyle changes, unhealthy lifestyle changes, lack of energy, lack of going out, bad eating, smoking, further increases the risk of heart disease.
Small group, I thought I could get away with that, but no. Thank you very much, Margaret. Okay, so it's how we present ourselves. Liz covered a lot of this, and it's also on your bookmark. I'm going to briefly go through it so we can save some time for questions and answers. But basically, let's start at the top of the head. Headaches and feeling extreme fatigue, that sort of thing. And moving down, of course, we can feel chest pains. And we can have arm pains, but that's not usually how we present ourselves. The only time was when I was having a heart attack towards the end. I felt just some squeezing or tightness, but it doesn't necessarily have to be the heart attack that you see in the movies. And then also gastrointestinal problems. For some reason, you can have a very upset stomach, even causing vomiting. So it pretty much runs through our whole body. You know, our veins are smaller, our hearts are smaller. At one presentation symposium that I went to, I've gone to a lot of conferences and symposiums, they actually say that women's heart disease is it's a totally different disease than men because of our small vessels and our small hearts. Our hearts are about 4 to 6 ounces. Men's are 6 to 8 ounces. And it's just the difference in the dynamics of that trigger different emotions and feelings of having a heart attack or heart disease. Anyway, if you feel anything that's odd or unusual, and it's consistent, you really do need to contact your primary doctor or a cardiologist. The symptom that I do recognize, and I haven't mentioned, it's a feeling of imminent doom. And believe it or not, that is a symptom you just feel like you're going to die, then that's imminent doom. And that's a scary, scary thing. It kind of feels like anxiety. And I have to say, I've had enough anxiety now after having all these heart issues that it does present itself much like issues of having heart disease. Um, so anxiety is rather common with us too. It is with men also. But the pressure, um, the chest, nausea, I think we've just about covered it. But it's rather unusual symptoms. And I always tell my friends, just put your hand on your chest when you go into the emergency room or when the first responder comes and say, I think I'm having a heart attack. As subtle as some of these symptoms are, it's a vital indication that you are in trouble. And if you're not, as I say, at least at this hospital, they're happy to see you. They welcome you in. They give you that blood test immediately to see if there's a blood enzyme it's necessary that reveals that you're in the middle of having some heart issue. Well, okay. In conclusion, I just want to say that it's really fun talking to my friends and you on Zoom. And also, um, take care of your hearts because your heart beats 80,000 times a day. So we have to have respect for that and take care of our hearts. It's the most vital organ in our bodies. So thank you very much. And we're going to take some questions and answers. And
This may be something that everybody here knows about, and it's old hat, but I've had triple bypass in January, so I'm just 5 months after that. And when you talk about coronary artery disease, what part of where my mind goes anytime now that I have an itch or a little pain anywhere in my body, I think, oh my God, this is related to that. Uh, Why aren't the arteries throughout the body the same as those that go to the heart, and aren't they affected?
okay, coronary artery disease. Yes, you have arteries in your heart. I'm not a medical person, and I would say to you, if I was visiting you in the hospital, that would be a great question for your doctor because we don't talk about medical. But throughout your body, yes, it's a vessel disease. You have veins and small arteries, and throughout your body. And to have a disease in your artery is a buildup of plaque.
Mhm.
And it's the plaque that builds up. Sometimes it breaks away, sometimes it hardens up. That's called arterial sclerosis. And then you can have a breakaway of that and a blockage in your artery. And so I know on my father's death certificate, it said arterial sclerosis triggered his heart attack. But um, yes, we have vessels everywhere. That's even in our brain. That's why, we call it a brain attack. But the problem with vessels is they can become blocked. We're doing a lot of interesting things with leg vessels. Dr. Diamantacco, he gave a great presentation to our Mended Hearts group or the symposium about what he does about blockages in your leg. So if you do have some numbness or feeling or swelling or something in your leg, it could be a part of your cardiovascular system. I don't really know what more to say, but that coronary artery, cardiovascular disease is the overall concept of heart disease. And then I have coronary artery. And do you have a specific name? Congenital heart disease. Great. Carl.
Thank you.
First of all, I want to thank both of you for your presentation. Extremely helpful, extremely candid, extremely personal. So thank you very much for that. I don't know if I really have a question, but I have somewhat of a dilemma that I'm going to present to you, and maybe you can just address this briefly. Carolyn, you were talking about the heart attack warning signs for women. So, what I have found for myself is since I've had heart issues over the last year and a half or 2 years, and to this gentleman's point as well, now when I have any kind of an issue, it's hard for me to determine because I haven't really, I think, I don't know what it is, whatever this process is that you go through where you have to come to terms with something kind of a new normal. Um, so looking at, I mean, I had an episode of dizziness, for example, a couple of days ago. That's on the list. But I attributed it to the winds and allergies and so forth, and it abated and so forth and so on. I'm just finding it difficult to self assess. And can
Oh,
you
oh.
address that?
Oh, want to address that?
Is that sort of what-
Totally. No, I totally understand. Exactly.
right? Well, and to put it in context, I have been taken to the hospital by those wonderful paramedics thinking I was having a heart attack. So, I mean, I have tried to be as responsive when I felt I needed to be, but not overly reactive. So I'm trying to hit that healthy balance.
Yes, that is a fine line. I totally understand that. For a while, I never had it before, but afterwards I did have post-traumatic stress and a lot of anxiety for the reasons you're discussing right now. How about you, Liz?
Yeah. Oh, yeah, everybody goes, I think you go through that.
So you begin to
Time.
takes time to know your body well enough to know if it's an issue. Now, shortness of breath or fatigue or the dizziness, especially here in the desert, could be dehydration or other things. I'll tell a little story out of school since I'm not a medical person. Because I was having ongoing anxiety years ago, they used to let you have Ativan or lorazepam. And I would take that occasionally when I was getting on an airplane or something, if I knew I was really going to be anxious. Then they won't give it to you anymore. But that's how I used to figure out if it was anxiety or not. But I can't do that anymore. But since I don't take that medication, I just sort of breathe deeply, drink lots of water, and hope that the feeling goes away. And if it doesn't, I've also called 911 twice since I've lived out here. And you just, that is a wonderful question. And I think of that question myself. And even when I have gastrointestinal problems, I think, aha, new symptom. Then I try and track back, what did I eat? And then I get my medication for upset stomach out and I take that and pretty soon it goes away. But I don't know how to answer that, Margaret, because we suffer from the same thing.
Yeah, a couple months ago, the same thing. I was out at the glass place doing some glass stuff. I do glass fusion and I got dizzy. And of course, the first thing you think of, oh, it's my heart. You know, that's the first thing that comes to mind. I had to lay on the floor in the glass room for a few minutes. I eventually went home, called my doctor, the one I keep busy, and they had the pacemaker place clinic call me because they can run. Yeah, I have a box at home and they can take a reading on my pacemaker, and it's like, nope, wasn't your heart, you know. But that's the first thing that comes to mind. And eventually, my regular doctor and I, figured out it was probably low blood sugar. I eat an early dinner. I get up in the morning. This was like 11:30 the next day. I hadn't eaten since like 5 o'clock the day before. I hadn't really had water. I'd had my coffee, of course. So it's just, I have to really now make sure I get up in the morning, I'm having breakfast, I'm drinking some water, and just pay attention to my body. But you're right, it's always there. It's always in the back of your mind.
Thank you. Since you were mentioning that an apparatus that can do that,
Yes.
I was wondering about these watches now that you have that can, you wear them and they're constantly receiving signals from your body for this and that. Is there anything out there that would help if you just wear one of these special watches that could identify, what's going on or if it's not happening?
Because what they can tell you is like if you're AFib or flutter, if your heart's racing.
Uh-huh.
I was just asking my son about that because he had a new Apple Watch that told him everything. And I said, I don't have an Apple phone or or an iPhone, or I don't have an Apple computer. So I don't want to. Anyway, he said, well, Mom, I think you can go buy a Fitbit.
Fitbit. Yeah.
He said that tells you, your heart rate, blood pressure, and all that vital information. But I know down the road I'll have a pacemaker and maybe then. But yeah, I have heard. I mean, what do you say, Greg? You wear one too, don't you? A watch like that?
Heart rate. Heart rate and one other thing, but it can't diagnose
Tell you if you're-
anything with regard to
Diagnose.
heart attack or anything. It doesn't do blood pressure. So heart rate and,
Yes.
yeah. If it,
You could even, of course, it might be hard, but you could go to urgent care. Are you near an urgent care? They're real good about welcoming you into and checking. But if it's a heart issue, they'll call the ambulance. You know that. Yes. Very good. Well, as I said earlier, I think we're preaching to the choir. We know that many of you out there have had heart issues and identify with what we're sharing. And it was just lovely to spend an evening of therapy with you all.
Well, we truly want to thank both Liz and Carolyn. They've told us some very frank things about themselves and shared with us their particular issues that they've had and misdiagnosis, and have come through this with this amazing positive uh, persona about them all along, even though in the tough times. All right. So, and a couple of your comments about things, our heart's not your big toe. And when somebody says you got a heart problem or something, it takes on a different meaning than your big toe. It's not like you got toe fungus or something, like that. So anyway, it's maybe it is a fungus in your arteries of some sort, really. But anyway, so that's kind of it. We are so pleased that you're doing this. We didn't have any questions on chat room, but then again, I was the chat room operator, so if the folks that were on Zoom, I'm very sorry about that. You get plugged in these small jobs and everyone, whoops, whoops, whoops. So a couple of things before we adjourn the Zoom session in our local session. Next month on June 12th, we are going to be honored by having the Chief Nursing Officer, Ben Farber from Eisenhower Hospital here, come and talk to us about stuff. And he's going to talk to us about all the kind of stuff as it relates to nurses. He's going to talk about the difficulties they had during COVID with nursing and all that sort of stuff. And then the general stuff about nursing. So it's the first time he's ever come to talk to us. So it'll be really awesome. It's going to be on June 12th. So immediately following this meeting, we're going to, right away, as soon as we find the person that's going to do this, we're going to have an installation of officers and appointees in a formal sense. We haven't done this in years and years and years, but we're going to do it tonight. So those folks are here, and the members particularly, but anybody else, if you'd like to stay around, we're going to do that pretty quick. So you can get a cup of coffee, have another brownie or some darn thing like that for a heart patient. You know how those are. So we always notice that generally the brownies and the lemon bars and the cookies go first. That's normally it. The heck with the vegetable stuff. Anyway, so if you'd like to stay around and ask questions to anybody here, we'd be happy to do that too. So at this point, we're going to terminate the Zoom or close it down. It's not like terminate, it's not a terrible thing, but anyway, Susan Velde, who is the clinical supervisor on 4 South here, the big cardiovascular wing, is going to come out and officiate for our installation of the officers and attendees. So I know she's over there in the nurses thing on the other side of the building, but she's supposed to be here pretty soon. So we'll do that. And we thank you all for coming. Thanks for the folks on Zoom. Appreciate it very much. Have a good evening.